Senator Hassan, member of the Health Committee, which Patty is ranking member of.
Well, thank you, Senator Schumer and Senator Murray. I, too, am cautiously encouraged by the majority's decision to withdraw the bill today and agree with Senator Murray. We were making good progress in our Health Committee on bipartisan solutions to stabilize the market, lower costs, and ultimately improve care for the American people. But I do want to express some caution here and return to an exchange that happened last night during the CNN debate, because it involved a constituent of mine from New Hampshire, and because I think it reflects the flaw in the substance of all of the Trumpcare efforts and the latest Graham-Cassidy Trumpcare effort. A Granite Stater named Ashley shared her story, as she has shared it before, of substance use disorder. She talked about the fact that she lost her husband to an overdose and then eventually, through New Hampshire's drug court program and through Medicaid expansion, got treatment. Ashley's now in recovery. She gets her insurance now through her private employer. So she asked my colleague from South Carolina how to respond to the fact that without Medicaid expansion, she wouldn't have had access to the treatment that has helped her get well. And the good news is that my colleague from South Carolina acknowledged that substance use disorder is a disease. The difficulty is that he then said to her, and this is a quote, "It's not Medicaid expansion that saved you." I think that reflects an absolutely fundamental lack of understanding, not only of the opioid crisis and the importance of health care coverage for people who suffer from substance use disorder, but I also think it reflects a disconnect here between the Trumpcare efforts and the real goal of providing lower costs and better health care for the American people. Ashley knows that without health insurance coverage, you often can't access treatment. When people tell constituents that they don't understand their own health care journey, it demeans that journey and it demeans the constituents. It demeans the very people we should be listening to and who we are sent here to represent and to help. Our constituents are telling us about their personal experiences with health care. They are often really laying themselves bare before us so that we will understand the importance of health care and health coverage to them. We have seen people come to the Capitol this week and all summer who suffer with significant disabilities, and it is not easy for a lot of these people to get here, to be out in the sun, to wait in long lines, and frankly, they shouldn't have to. They shouldn't have to come to Capitol Hill and beg for health insurance coverage, not in the United States of America. So we know that there is more to do on health care. There isn't a Democrat here who doesn't know that there are improvements we need to make. I am committed to working with members of both parties on the Health Committee and throughout the United States Senate to come together and find ways in the short term to stabilize our markets and lower costs. We have to address pharmaceutical costs. We have to address health care outcomes. But as long as there is this threat out there of another Trumpcare attempt, it's going to be harder for us to do that. And it's going to cause disruption in the very lives of the people we were sent here to represent, who don't choose to get ill, they don't choose to experience a disability, they don't decide that they're eager to go to a nursing home. They need our help, and they need us to listen to them about the way health care actually works. And if we do that, we'll forge our way forward and bring real results for the American people. Thank you.